Okay, so tell me about yourself. What do you do?
I'm Becky Tuttle, and I am the branch director for the Greater Wichita YMCA for the Community Development Branch.
Okay. So, what drew you to a career in public health?
I really started my career in public health in a non traditional way. I was actually a school counselor, and I
Okay.
was working in the school district in North Carolina, and I was a drug education counselor, and then I became a counselor, a school counselor in a middle school, and I got invited by our superintendent to join a community coalition at the health department that was addressing tobacco use. And I really didn't understand why I was going because I thought, I work in the schools. Why would I go to the health department? And so I quickly realized that my favorite part of every month was that meeting, that it was a group of people who came together to collaborate. Everybody had a different job or a different way that they did their work, but everybody had the same goal of wanting to make kids healthier. And so I always tell people that I was probably the worst school counselor ever because I wasn't really interested in making kids better. I was much more interested in making the community better for kids.
Okay. What type of projects have you coordinated or helped with this past year?
So probably is many more than I could mention, but I have the good fortune of being the chair of the Health and Wellness Coalition. So we focus on projects regarding access to healthy foods and active transportation. So probably one of the highlights of things that I've got to do this last year is to help innovate a bike share ICT program. So we sought the funding out and were able to work with a vendor, and during Bike Month in May of 2017 we launched Bike Share ICT with 105 bikes and 21 stations in our community. So that's great. Also, we have our traditional events like our Working Well conference, but this year we also did a We All Eat event, which focused on food access, healthy food access, where over 500 people from the community came to learn more about healthy eating. So that was something new and different and very exciting. Continue to work with the Health Alliance and everything that we do to support the Community Health Improvement Plan. So this was the first year of our 3-year Community Health Improvement Plan for Sedgwick County. So all of that work is fantastic. And then everything that I do here at the Y with our urban outreach programs, our corporate wellness programs, our disease management programs are all public health. They're chronic disease management in some way, but most people wouldn't necessarily recognize the YMCA as public health.
Right. What challenges have you come across in public health?
I think probably the biggest challenge that led to the development of the coalition of coalitions building the case for public health is cuts, funding cuts specifically. The infrastructure of the Sedgwick County Health Department in 2015 was radically changed. It was 8 positions were cut, and an entire division of health education was cut. And so when that happened, it changed not only the work of the health department, but the landscape of our community, because no longer did we have a chief health strategist within our community. No longer was the health department the convener of different initiatives and meetings and coalitions. So community partners had to really step up for that. And some things we were able to absorb within other programs, and unfortunately some things were just cut and we haven't recovered from that since. So definitely one of the biggest challenges, but I'm quite proud that the public health community in Sedgwick County is working together to see how we can make things better.
Okay. If you had to pick one topic to shed more light on or to fix in public health, what would it be?
My mind first goes to, obesity or diabetes, but I think truly if I could have one rally call, it would be continued education on what public health is, public health prevention, chronic disease prevention, all of those things. If more people were aware of it, I think that some of our fights for funding and for, collaborations and for partnerships with non-traditional partners wouldn't be as challenging. Many times when people hear of public health, they automatically think of people who are lower income or disadvantaged, and that's not the case. Public health, everyone faces it or is affected by it every day. The water that you drink, the air that you breathe, the clean air that you have when you go into a restaurant, the opportunities to be physically active, the opportunities for food access, the opportunities for transportation. healthcare. There are so many things that fall under the umbrella of public health, and I think if more people were aware of that, we'd have even more opportunities for partnership and collaboration.
Okay, and what's the best part of your job?
The people that I get to work with, without a doubt. My staff here is absolutely amazing and works so hard every day because they want to, they care, they're doing jobs that they believe in. Also, all of the community partners that I work with are not only just colleagues, but also dear personal friends, and I call my staff and the people that I work with my work family. So the work that I do is incredibly meaningful and brings me joy, but the people that I work with are really the best part.
Okay, thank you.
Thank you.